Right, so I wanted to do another video just real quick, and I wanted to keep you updated on what's been going on with Mackenzie. Mackenzie attends her group. We group for children with disabilities. She attends that 5 times a week, and she also now does DIS, which is Developmental Intervention Services, twice a week. She has occupational therapy, and she has speech and language. So she's a very busy girl. So when you have a child with a disability, it's very crazy. You have all these different courses and classes and things that you must attend to try and help your child. So it's just it's been crazy for her. And it's hard because in these sessions I think my dog's having a stroke. He's literally, I think he's having a stroke. In these sessions, Mackenzie gets very, very upset and cries. The whole point of them is to try and get her to purpose play, because apparently learning to play appropriately is the foundation building blocks to learning how to speak. And that's why she can't speak, is because she doesn't play properly, which I know. You just thought playing was playing. I did not realize that how playing is such a important role for a child. But it's hard because Mackenzie, like, for example, they have like sort of a plastic pig. You put like these big coins in, where Mackenzie, instead of, obviously that's the goal, is you take the plastic coins and you put them in the slot, and where Mackenzie would rather take the plastic coins and stack them. So, when the woman sits down to, Mackenzie will sit in front of the lady, the one that's helping her, like the therapist or whatever you call her, and try and get her to play, put the coins in through the slot. Where Mackenzie would just rather stack them, and then what happens is the woman will go, no, you're doing it wrong, and then show her, and then Mackenzie throws a complete another meltdown, and it's like, also along with autism, Mackenzie was diagnosed with a severe learning disability. So she has no understanding communication. So I can imagine how much frustrating it must be, when you think, oh, I'm just playing with something, and then someone's just taking it off you and making you play it another way. She probably just doesn't understand. Why can't I just stack the coins? Why, so it's hard. I to be honest with you, like, after these sessions, most of the time I'll sit there and cry in my car afterwards, because I hate seeing my daughter upset. I hate seeing her cry. And the sad thing is, during these sessions, I'm not even really allowed to console her. A few times, I'll go and hug her, and I'm being sort of told, no, just, don't draw attention to it. Just let her calm herself down. And I'm like, it's my job as a mom. My child is upset. I need to be able to console her. So it is quite difficult, but these are the things that, we as parents go through, and we don't really talk about a lot, is how emotionally draining it is to see your child upset, and then, like, these sessions, my son had them, all children with disabilities have these sessions, and the goal is, like with Tristan and stuff, it would have been to try and get her to speak and try and, but I was already been told that Mackenzie is so severe that the only goal for her in her occupational therapy and the DIS is just to get her to sit and purpose play. So there's no trying to communicate, because she is nowhere near ready for that at all, which is incredibly difficult. And then with speech and language, which I did state that we have that also, the speech and language is not to try and get her to speak, because, again, I've been told that she's not there. It's to get her to learn Macatone and get her to learn cards. So if she wants something, then she can give me a card. So that's how we're trying to get her to communicate. That also is proving very difficult, because she's just so crazy. Mackenzie just never stops. That, she has to take the time to look at the cards, or to try and look at the Macatone that I'm trying to use with her. So it's hard. It's slow. It's a long process. It's slow. But you know what? Whatever I have to do to try and help my child, and every other parent is the same, you will do it. It's just not easy. It's not easy at all. But that's sort of what we're dealing with. And that's it. No worries. Signing out. Bye.